to the Anxiety at Work podcast. I'm Chester Elton, and this is my co-author and dear friend, Adrian.
Well, we welcome you all to our podcast, and we hope that the time you're going to spend with us will help remove the stigma of anxiety and mental health in the workplace and your personal life. And we invite experts from the world of work and life to give us ideas and, most importantly, tools to deal with anxiety in our world.
Our guest today is our new friend, Shahana Alibhai, Dr. Shahana Alibhai. She is a speaker, a family physician, and a mother of 3 energetic young boys. She has worked with a multitude of organizations to gain more clarity into their employees' mental health. She is also a lead physician at one of British Columbia's largest youth health centers. Much of Dr. Shahana's career is focused on those struggling with their mental health, and we are delighted to welcome you to our humble podcast. Thank you for showing up.
Thank you so much for having me. It's a pleasure.
Well, we are thrilled to talk to you today. Shahana, you've been very open about your own postpartum anxiety after your first child, and you said resulting denial, shame, mental health issues. So if you could start by walking listeners through your journey and how that's helped you as a physician and also your work with organizations.
No, absolutely. You know, it was so easy for me just to live my life and completely ignore the aspect of mental health. Here I was, a physician that treated mental health every single day. But for me, you know, unbeknownst to me, it was a you disease. I'm completely empathetic. I'm completely compassionate, totally supportive, but it's a you problem. It would never be a me problem. And I think part of that really comes down to ego. And it wasn't until the birth of my first child, you know, here I was, I knew our diagnostic criteria inside and out. I could recognize anxiety, panic disorder, OCD from a mile away. But yet it took me over a year in order to get help. And that speaks to the shame, the denial, and the guilt. And it speaks to the fact of what nobody ever wants to talk about with mental health. And that is that if you suffer with mental health, you are weak. You are less productive. You are unreliable. You can't snap yourself out of this. You know, that is the elephant in the room with mental health. And I think thanks to podcasts like this, thanks to platforms like this, we can finally just speak towards that is completely the opposite. But I have to say, I think I even harbored a sliver of that notion until I found myself as the patient. And in fact, you know, I think I hide behind the words postpartum anxiety, but there's a deeper truth there. The truth was that I started to suffer symptoms at the age of 4 and 5 of something that I didn't really know what it was. I knew something was wrong, and this is 30 some odd years ago. I approached my mom and she didn't know what it was, and I lived in silence. I knew something was off with me. And it wasn't until 20 years later at a psychiatry lecture in medical school where they flashed a slide before me, and it showed the different types of anxiety. And one type, of course, as we know, is OCD, but a subtype of that is pure OCD, where you just have these debilitating, intrusive thoughts, but you don't have the compulsion, so nobody recognizes it. Fast forward to the postpartum period, I had postpartum anxiety, but the truth is that I had postpartum OCD. See, anxiety and depression, because of platforms like this, I think a lot of us are more comfortable talking about. But use the word schizophrenia, bipolar, OCD, suicidality. What happens? People take a big, giant step away from you. It's too much. It's too much.
Yeah. You know, isn't that interesting? Doctor, heal thyself, right? Mm-hmm. When you're the physician, when you're giving the advice, you can't have a bad day. You can't be suffering from these symptoms. I thought that was so interesting that you said you could spot it a mile away in everyone but yourself.
Absolutely.
Now, you did talk about something, too, when you start getting into the specifics, how that really does make people panic. Do I have suicidal tendencies? Well, I could never share that with anyone. I mean, that goes from an issue to horrific in a nanosecond. So, you know, you talk a lot about self-care. So how do you explain what we should be doing better to take care of ourselves when we've got all this guilt piling up, when we've got all this perceived weakness? So walk us through that. You speak a lot on self-care. What can we do better?
You know, I think the genesis of this for me was that I I found myself hitting rock bottom. I found myself with exactly those notions of not wanting to be here anymore, and everything that is for a lot of people what they would call their wake-up call. But what I didn't understand was that here I had studied medicine for 10 years. I had studied kinesiology and nutrition before that. So how did I go so wrong? Here I thought I knew the human brain. I thought I understood the human body. I was trying to take fish oil to get my way out of this. I was trying to yoga my way out of this. And not to say that nutrition and exercise are not helpful, but when I myself was an empty vessel, I was just putting pretty colors on the outside of a beautiful vase. I was empty inside. And what I designed on the back of a napkin one day was what I call my optimal health pyramid. And it's just a pyramid. You can find it on my website. But the idea being that the foundation of the pyramid has to be training your brain how to think better. No one ever teaches you that you need to work at this. And the clock resets at midnight, right? You have 24 hours in a day of chances to try to train your brain to serve you better. But we've never gotten taught that. And speaking to your point, the root, if I could tell you one thing to improve for me, it's not yoga, it's not exercise, it's not eating better, it's self-awareness. And self-awareness is simple, but it's not easy whatsoever. And it's trying to create some space between you and your thoughts so that you're not flooded in this thunderstorm of thoughts, but you can kind of observe yourself. And if anything, can we be more curious about our thoughts, just like my toddler, versus critical of ourselves? And is that hard to do?
Well, that's where I wanted to go next, is because you talk, in fact, you have a blog. I'd encourage everybody to check that out. But you talk about changing our emotional state from negative to positive. So I was just chatting with somebody yesterday who said, my tendency, they said, it's like a funnel, where you drop the coin and it goes around and around the funnel. And she was saying, she's not just me, but my whole family, everything, we immediately go to the negative. Something bad's going to happen, and that coin just goes down. No matter how many times we pull it out, it just goes back down, gets sucked down. So how do you break that cycle of negative to more positive?
Oh, I love that. That's a great analogy because it's so visual. You can actually see that coin going down the funnel. But if anything, I'm going to share, hopefully with your listeners, a really, really quick acronym that I've got 3 boys under the age of 6. I have many chances every day to practice self-awareness and patience. It is an exhausting process. So I did this for myself, and the acronym simply is N squared, S squared. So 2 N's, 2 S's. The first is just noticing. So just like that person you were talking to yesterday, good for her because she's noticing that she tends to fall into this tendency. But can we take it a step beyond that? We've become so dissociated from our bodies that we live in the culture of we're fine. How are you doing? Oh, you're great. Everything's fine. And we tend to live that throughout our day. And even when you're clearly not fine, even when your heart is racing and you're short of breath and your palms are sweaty, we lie to ourselves and we tell ourselves that we're fine. So I invite you just to notice how your body is actually feeling without judgment. But just take a second. For me, as I pull up into the garage after a long day treating and seeing mental health patients, I know what I'm faced with at home. 3 rambunctious, bouncing off the wall, energetic boys. And I can feel my heart start to pound. I can feel myself getting already anxious before I enter the door. So I try to catch it early. That's the noticing part. The naming is to just give your emotion a name. Studies have been done where we only know 3 emotions, bad, sad, or glad. That's not good enough. We need to increase our emotional bandwidth. 2 members of my family recently got into a disagreement, and I found myself thinking that I was really angry, but it wasn't anger. It was embarrassment. And it was fear. Treating embarrassment, treating fear, treating anger are completely different things. So how can you increase your emotional vocabulary to give the right name? Most of the times I'm not anxious. You know what I am? I'm depleted. I'm tired. I'm overwhelmed. Use the right words. Then next S is my favorite, and that's the story that we tell ourselves. So even with that person you were talking to, she might be telling herself the story that everything in her family, they just go to the negative. But dig a little deeper. What is that story that you're telling yourself? And if there's one piece of advice I could give you, Within your story lies the significance that you crave. For me, the story I tell myself is that I'm the mom that does everything. I do the pickups and the drop-offs and the lunches, and I see patients. What do I want? I want someone to give me accolades. I want someone to look at me and say, oh my goodness, you're doing a lot. And guess what? No one is going to do that for you. But within that story that you tell yourself is the significance that you oh so crave. And finally, it's the shift part. And the shift is not easy. The shift is breaking that inertia. And it could be simple things. It could be going to a different environment from where you're getting the thoughts. It could be going outside. It could be taking a deep breath. It could be, the best analogy I love to give my patients is that imagine a white handkerchief. We don't have handkerchiefs anymore, but imagine one with a black spot on it. Zoom out. Change the lens of your camera. So I have all of this stuff on my website. But that simple N2, S2 is a way to break the cycle.
Such great advice. Thank you. That naming part, I think, is becoming really important. Because if you give it a name and you identify it, then you can deal with that issue. Which brings us to a lot of your work with youth. That's kind of your specialty, right, is youth mental health. Why are we seeing so much depression in young people and self-harm and addiction? And what can we do as adults to maybe spot it earlier and to be of help? We saw through the pandemic, all those things spiked. And as parents and just as neighbors, we need to be more attentive, don't we?
Oh, well, it's honestly thanks to places like this where we can have this conversation. Studies have shown the number one thing that helps an adolescent with their mental health is not medication. It's not journaling. It's having a trusted adult person, not even a parent. It's someone that they can fall back on. Remember those games that we used to play when we were a child, the trust fall, where you have someone kind of almost catching you in the back and saying, okay, I trust that you're going to catch me. And that's what an adolescent needs. And speaking to the reason why we're seeing so much more of this, I think not only, thankfully, are we having dialogues and conversations about this, which is very important, but bring on COVID, bring on social isolation, and bring on the advent of social media too. This notion of everything through my lens is comparison. Everything is negativity. Everything I am less than. And you're asking youth whose prefrontal cortex isn't fully formed until the age of 21 to be dealing with these huge, big emotions and issues. And that's a lot for them. And no wonder we see the advent of substance use. I had a patient the other day who was 17, ended up in the hospital with pancreatitis. And I said, why? Why were you drinking so much? I just want to know. And I approach it from a place of not judgment. I'm just curious. I said, is there something bothering you? Is there something that happened to you? Tell me. And she looked at me and she said, no, I'm just bored. I'm bored, right? So sometimes we also need to recognize that mental health doesn't look like what we always think of it. It's crying in bed, having a panic attack in the corner. I call it the three amigos of mental health: numbness, loneliness, and sheer utter boredom to the core. Right? These are the unrecognized signs that I see a lot in adolescents. And I tell them clearly, just because you mention it to me, I do not need to medicate it. Mentioning it doesn't mean to medicate it. And anxiety and low mood are adaptive. There's nothing wrong with them. But where and how is it affecting your quality of life? And that's where we dive deep into.
Yeah, this is such great information, Shahana. Where can people learn more about your work? Where would you send them?
Yeah, this avenue of speaking for me, I'm a full-time mom, part-time doctor, but my speaking and doing this is something that just speaks to my soul. So on my website at drshahana.com, on Instagram, please come say hi to me at the Dr. Shahana. And I'm putting out a video course too, just so that we can kind of capture this information that I so wish I had learned years ago.
Well, I want to keep going on this discussion of youth because it's when Chester and I, we speak to corporate audiences, inevitably we get rushed afterwards. I've got a 20-year-old, I've got a 19-year-old, I've got a 30-year-old, and everybody's interested in younger people. One of the things you wrote on your blog recently was you pray for grit for your kids? Well, I think we all do, but why do we want grit, and more importantly, how do we get that kind of resilience in our youth?
Oh, yeah, exactly. So, my parents came to this country as immigrants from Uganda, right? When they came, grit wasn't even a part of our lexicon. Grit just equaled survival. You had no choice, right? You just made it work. Nowadays, many of our youth have this cushion to fall back on. And not that there's anything wrong with that, but it's so ironic that even though they have this cushion to fall back on, they almost become frozen by failure. Frozen by failure. And I was in my 20s and I was in a relationship that didn't serve me, and I was in a profession. I was actually in chiropractic school for a year, and I loved the profession. I would have just been a great counselor chiropractor. I just don't do very well with my hands. So, that nobody really wants to see a chiropractor for counseling. So I learned very early on that those two things did not serve me. But you know what the issue was? I was fossilized by fear. I couldn't make a move because I was so petrified that I was going to fail. So nowadays I teach my youth that, can we fail small and fly big? Can we practice failure? Is there a way to do that? My son is just recently learning rollerblading, and we have all of his pads on and helmet on, and he learns a practice fall. It's reframing our approach towards failure and knowing that even if they do fail, well, that's where the cushion is. That's where someone is going to catch them too. But for me, that encompasses grit. How we can work towards not being frozen by failure. And that's a hard thing to do, but it starts at an early age.
I just heard this yesterday too, again from a younger person and because I was doing a coaching session yesterday with one of my leaders that I work with, and he says, there's this failure to launch. He says, I can't get younger people who work for me to get started on a project. And we started talking about this idea of failure. And, the idea is, A, what's in it for them if they actually do succeed, other than a pizza party? How are you going to make them feel like this is worth taking a risk? But most importantly, do you have their back? And you're right, so many young people don't feel when they come into the workplace, anybody's got their back.
Exactly. And I have to say, the youth that I work with come from such difficult circumstances. So they've never known certainty. They've never known a typical family structure. And they have a lot more resiliency and grit than if I look in some of the type A perfectionist personalities who have lived their life in such a tight box and are so worried about, and I was one of them, about stepping out of what that so-called norm is. But if we just refocus this just a sliver and say, even for those people who suffer from type A, and change their focus to not serving you, but how can you use your talent to serve someone else? Suddenly the focus isn't on you. Suddenly you can't fail. Because if you change your lens to serving someone else, it's like taking a balloon and rupturing it. It's not about you anymore. That's the number one question I ask my youth. When you're finally finished high school after all these years, because they're not in a typical school, they go through a self-paced program. I said, when you're done, what are you going to be? How are you going to serve? And I would say 97% have a concrete answer for me. So these youth know how they want to help someone else. They just need the words.
It's so interesting. You talk about frozen by failure, and a couple of things occurred to me, when you talk about grit. I think it's really important for people listening to the podcast and helping youth like you do. Sometimes I often, as a child, would confuse grit with never giving up, failure is not an option. Whereas grit really is, hey, I'm going to work really hard at this. It might not work out, and that's okay, rather than I am going to kill myself before I will give up. I love your story about in chiropractic school. You just weren't good at it. Sometimes you're just not good at stuff. Adrian and I grew up in Canada. Neither one of us became professional hockey players.
I came this close. This close.
I wasn't even good at punching people in the face. There were different roles for different players. So I think it's important to make that distinction between, grit and failure. Grit does mean you can also fail, which brings us to my last question for you, Shahana, and that is, we love talking to practitioners like you about your personal rituals, the things that you do to keep yourself, mentally fit. And you've shared a few things that you do in your rituals, and some of those were hard learned for you. So can you take a minute and just share some of your best practices that can maybe help some of our listeners. And
Oh, absolutely.
Adrian in particular. Yeah.
No, and thank you for sharing that about failure, because I think you bring up such a good point. I always tell my youth, failure is not linear, and you cannot choose your failures. If only we could choose our own failures. We can't, right?
Right.
So, but speaking back to self-care practices, or even just this, the word self-care is so overused, but just those daily fueling practices. Like I said, I'm a busy mom of 3, and I would love to wake up at 5 a.m. and meditate and exercise and journal. That's just not, that's not feasible for a lot of busy parents. But I'll give you guys a really simple, easy trick, especially for those moms and parents out there. When you're like a, mom taxi, like I am for most of the day, one of the things that somehow always works, and it's so simple, I call it the gratitude flood. It's from traffic light to traffic light. And it's a little game that I play with my kids. How many things can we say out loud that we're grateful for? And let me tell you, most mornings I'm probably not in the best of moods. Like trying to get 3 young kids out the door and be on time for work is not my happy place. So in the car, suddenly we're just going, I'm grateful that I had a bed. I'm grateful that my belly is full. I'm grateful that I've got clean clothes. And it spirals and it snowballs. And it's 1 traffic light, 2, by the, we're halfway there to school. So that's just a simple, tangible, easy, fun practice that really anybody can do.
I just have this image in my head of 3 rambunctious boys, and it starts, I'm thankful for my bed. And then it gets louder, and then it gets louder, and then it gets louder. I'm sure there's, that competition. What a great practice, like you say, from traffic light to traffic light.
And Chester knows where he speaks, by the way. He was one of 5 boys, so yeah.
Exactly. The youngest of 5 boys. I had to yell the loudest. That's one great. Do you have any other rituals you can share with us as we kind of?
Yeah, absolutely. So every morning I do try to at least take 5 or 10 minutes out and just try to crave silence, whether that's doing a headspace meditation. If I don't get that in my day, I'm a podcast junkie. I love to listen to all that stuff, but I will force myself as I'm driving to be silent just for a small period of time. I think we get confused that we have to really meditate and set aside this time. It doesn't have to be that complicated. But I'll be honest, I equate silence with a lack of productivity, right? And that's so the opposite. So I'll often ask myself this, and there's all these pockets of time throughout the day when I'm waiting to pick up my son, those types of things. And I'll ask myself this question: are you going to choose peace, or are you going to choose productivity? Because we live in a culture of one more text, one more email, one more phone call. Like, what can I squeeze in? But what we don't realize is the more you squeeze in, you're actually squeezing out from somewhere. You're actually leaking from somewhere, right? And that's taken me, a long, long time to realize. So that's my mantra. Am I going to choose peace or productivity? Can I just take a moment to just look up from my phone and look at the weather, make eye contact with somebody else? It's not these big, I'm going to go for a massage and get my nails done self-care. Self-care is making true eye contact. Self-care is looking up from your device. Those are the small things.
Oh, it's just been terrific, Shahana. Hey, such a great discussion. If you had to wrap up our discussion today, a couple of takeaways you want everybody to know from your work as they head out today to into the world, what would you say?
Yeah, very good point too. I would say this. I'm going to leave, people who listen with my 3 A's, and I think this is super simple to do. It's when you're feeling that kind of feeling that you don't want to feel, an uncomfortable feeling, I invite you to acknowledge your feelings. Like, actually feel it. What does frustration feel like in your body? What does sadness feel like in your body? Take a second. We live in a culture of, I don't feel anything, I've got my blinders on, right? The next thing is to assess it. When I was a little girl, I don't know why we used to do this. We used to put saran wrap over hot soup. Never do that. That's not a good idea. And
I've done that. Right? Yeah, absolutely. Everybody has, right?
Not a good idea. And we used to also poke holes in it too, and it would to vent that steam. So I often think about that analogy is that when you're telling that story to yourself, imagine pulling that saran wrap over that hot soup and venting it. Can you vent your own story? Can you poke holes in your story and say, well, is it true? Do I know for sure that those 2 people are never going to talk again? Do I know that person was talking about me behind their back? Am I 100% sure? And guess what? You're probably not. And last but not least, ask. Yeah, I want to feel sorry for myself. I am a self-confessed feeling sorry for myself person. But how long? How long do you want to feel sorry for yourself? Set a time. I'm going to feel sorry for myself until 5 p.m. this evening. And after that, I've had it. So those are the three things. Acknowledge your feelings, assess it, poke holes in your own story, and ask, does it serve me? Try that today.
Tremendous advice. Shahana, you've just been a delight to have on the show, and from me and from Adrian. Thank you for taking the time, and thank you for the great work you're doing with young people. That's an area that we're all concerned about, and that has really spiked during the pandemic. So I grew up in British Columbia. It's always great to have somebody from the beautiful province of BC. So thank you for taking the time. We really appreciate your expertise and your advice.
It's an absolute pleasure. Thank you so much.
Adrian, could she have been more delightful? Shahana Alibhai, Dr. Shahana Alibhai. She was full of great advice and perspective. Yeah. And, isn't it interesting that so much of this comes through a person's personal struggle, which, of course, she had. What were some of your key takeaways?
And that's where we started, right? Was as you said, Dr. Heal Thyself. She refused to see it in herself. And how much do we do this? Is that we have sympathy, but maybe not empathy. So our employees are struggling, but, or our kids are struggling, but we just don't see this in ourselves. Just about everybody has gone through something like this. And we need to be more aware. That's where this begins.
It is so interesting. As she was talking, it reminded me of the old joke, where the guy's in church and the preacher's talking about being a better neighbor. And after which the preacher comes up and says, so what was your key takeaway, Chester? He said, I just wish my neighbor had been here to hear it. We easily give advice to others and not ourselves. So interesting to me that it was the wake-up call. And we all tend to go through this experience where she said, I hit that rock bottom and I had to have that wake-up call. I was putting, the way she put it, I was putting pretty colors on the outside of a vase when really what was inside the vase. I was trying to yoga my way out of it or journal my way out of it. And I had to go deeper. I had to give it a name. I had to figure out exactly what it was. And isn't that interesting? When you label it and you can give it a very specific name, then you can start to deal with the problem.
Well, and pushing past the three that we all tend to do, I feel bad, I feel sad, I feel glad, is not good enough anymore. We've got to be able to put a name to what we're feeling. It might be embarrassment, it might be I'm depleted, I might be fearful, etc. The putting a name to what we're feeling is really the beginning. And then I really honestly identifying the story we're telling ourselves. Well, right. Yeah, I know those people were talking about me. I know they were. Really? Well, even if they were. Sure? Yeah. First off, are you sure? Secondly, what are you going to, are you going to let this go? How are you going to shift your thinking, which I think is the most important part of it.
Yeah. Her work with young adults and young people, I think, is really so admirable. And isn't that interesting that she talked about needing a trusted adult, someone outside your family that you trust enough to catch you? And wasn't it interesting when she asked one of her patients, so what was going so wrong in your life that you drank so much? And she just said, nothing. I was just bored. Yeah. I thought that was for me, it was like shocking.
It was, and it's a great reminder to us that it's not just overwhelming social anxiety that creates these feelings or loneliness, feeling alone, that sometimes we say, oh, anxiety, it's because you feel alone. No, in some people, it really differs based on the person. It might be boredom. It might be that, and it's not that you don't have stimuli. It's just, it might not be it might not be enough. It might not be you're feeling challenged. And so what really she said was changing our lens to serving someone else is really key to a lot of this. That failure to launch, that failure to paralyzed by fear, etc. How do we change somebody's lens to serving?
Yeah, I think she talked about numbness, loneliness, and boredom. The other thing too, I really enjoyed our conversation about grit. It's not practicing failure and being able to push through, putting on all your equipment, the practice fall. I immediately went to judo. I have friends that were big into judo, and we put our kids through taekwondo, and they teach them how to fall. They teach them how to fail, how to protect yourself, and her child with all the equipment, rollerblading. That idea of practicing failure. So many good things. I have to tell you, though, my favorite thing of the whole podcast was the gratitude flood. The
I knew it would be.
I know, of course it is. The traffic light to traffic light, and I could just hear these three kids just screaming at the top of their lungs, "I'm more grateful than you are." But what a joyful noise. What a joyful noise.
Yeah, I love that. Yeah, that joyful noise. So some great ideas. Hopefully you have a chance to listen to this podcast at least once or a couple of times and take some notes. I thought it was really helpful. So big thanks to Shahana for coming on the show. A thanks to our producer, Brent Klein, who takes all of our musings and puts out something wonderful every week. To Christy Lawrence, who helps us find such amazing guests. And to all of you who listen in, especially if you download, that helps us build our network and our listenership.
Absolutely, and share it with some friends and family. Be that trusted advisor that Dr. Shahana Alibhai talked about. That does look out and does notice. We love speaking to audiences about this subject. We talk about culture, we talk about gratitude, we talk a lot about anxiety at work, virtually or in person. If you've got an event and you want to talk about wellness, culture, resiliency, or anxiety at work, give us a call. We'd love to talk to you and to your people at any event that you've got. What did I miss, Adrian? I'm always missing something.
Pick up a copy of our book, Anxiety at Work, which you're now at the 1-year point. So we're thrilled that the book has helped so many people already, and we'd love you to be able to spread that message. And we just thank you for joining us today. Join our online community at wethrivetogether.global. And until we speak next time, we wish you the best of mental health.
Take care and be well.